So we can pretend that like it's the day of and you've opened this patient's profile within the EHR. And an encounter will usually be made for them already if they've been kept and roomed. And so I'm going to create a new chart note. And then this is what will show up. And if this patient is a new patient to us and we've never seen them before, which is what we'll imagine this patient is, let's just say this patient is coming in for their lumbar spine, and that's how we know about them because we don't know like what symptoms they're feeling or anything yet. We just know they're coming in for their lumbar spine. I'm going to apply the new patient template. I'm just going to use one of the lumbar new ones. And so now everything is populated, it's pre-filled, and then if they have MRI images, I'll have noted that on my inbox sheet, and then I know that I have to go into the MRI report and copy what the text of the MRI report is into it. We'll assume that this patient does not have MRI images or previously obtained X-ray images. They're totally new, coming in today for the first time. So now, before we enter the room, Dr. Howe will read the face sheet and whatever the MA wrote on it, like with the intake, and look at like, you know, what are some initial things that the patient has said about like the symptoms they're feeling, how long ago it started. And so you can get that information before even going into the appointment because it'll be on that face, written on that face sheet from when the MA wrote it. And so Dr. Howe will also look at the images himself, and he'll be able to read out the X-ray to you. And so he'll say something like, patient has 6 views, 5, moderate scoliosis, flat, and severe 4 or 5. So if he says that, then you know that it has 6 views. There's 5 segments. If they have moderate scoliosis in here, I'm going to add moderate scoliosis. And then he said flat, so they do have flattening of the curve. And then he also said that they have severe loss of disc height at 4 or 5. So, and severe disc height. Oh. So I've written in the manual other ways to report it. And if he does say something else, there is reference sheet. There is like a reference in the manual for how to report it. I typically, when he's saying it, I just write the words that he says out loud on a Post-it note, and then I'm able to take my time into typing it in here sometime during the appointment when I have some extra time. So now patient is coming in, he's talking, and then when he's talking with Dr. Howe, I can kind of get a sense that this patient only has pain across their low back. So I'm going to fill out some information here. So the patient is a 54-year-old male. And because he only has pain in his low back, let's just say it's across both sides of the back. I'm going to say he has chief complaint of low back pain. If it's on one side, I'll just say like left or right low back pain. And then this patient is, I'm just going to say this patient is male, even though it's marked as female, but this patient reports he had onset of symptoms. And let's just say Dr. Howe asked him like, oh, like when did this start? And then he says something about like, 10 years ago. And then Dr. Howe asks him like, where is the pain located? Like, can you show me where it is? And then if this patient is pointing to like across the low back or like just like right on the sides of his spine. Different ways that you can say are like if he's pointing like, hers across my entire back, like it's like a band across my entire back, then you can just say across the lower lumbar region. If the patient says like, it's just like along the middle of my back, or just like on, or it's just like in kind of like off to the side a little bit, in the middle of my back, you can say lumbar paramidline region, or in the lumbar paramidline region. And then you can also say the side. So and then if it's kind of more on one side than the other, then I would just say in the left more so than right, for example, or lumbar. So that's different ways that you can say the low back pain based on, where they're feeling it, but typically it doesn't vary more than that, because that's the terminology we use to report it, and it doesn't really get much different than that if it's just low back pain. And so if it is just low back pain and the patient isn't feeling symptoms like radiating down their legs, then we know that they don't have any radiculitis, or like at least it will seem like they don't have any radiculitis. So you can delete this line altogether and say he denies any radicular symptoms. I'm just gonna go back and say that. And so now that we know that the pain is only across the low back and he doesn't have any radicular symptoms, typically I'll just start by filling this in by saying intermittent aching dull pain. Because facet joint pain, which is what pain only in the low back usually is more like a dull, achy pain that comes and goes and is often triggered by activity. And so this is what I'll say. But if the patient, says, he'll ask him, like, is it intermittent? Is it constant? And the patient explicitly says, like, yeah, like, it's constant. It's there all the time. It doesn't just come and go. And I'll just change it to constant. Anyways, I'll leave it for intermittent for now. And then for activities that exacerbate it, he'll just say, like, what makes it worse? What makes it better? Sometimes patient will say, like, like when I'm standing and walking, it gets worse. Or if I'm sitting for too long, which is prolonged sitting, or if they're driving, or if they're bending, lifting, any of those, just list out on the second half of the sentence, like the activities that kind of make it worse. So I'm just going to say standing, walking, bending, and twisting activity. That's what makes this patient's pain in particular worse. And here I'm going to fill in like what provides relief. Usually patients won't say it because, or sometimes patients won't say it just because, like, they're coming to the doctor's office, they want to tell the doctor, like what's making their pain worse, and they want to talk, they want to talk about like the symptoms and problems that they're having. And so sometimes they won't mention it. Default answer is lying down. Lying down provides relief, but sometimes also sitting and lying down provide relief. If they didn't say sitting makes it worse, then sitting probably makes it better. And so usually it's this. Sometimes patients will say walking makes it better, standing makes it better. And now patients will also sometimes report that they have sleep disturbance due to the pain, or they think that the pain is worse in the morning. And so right after this line about the pain, I'll add he has sleep disturbance due to the pain. Or any other, like if it's the pain is worse in the morning, or if they have sleep disturbance, or because the pain is so bad that they're using something like a cane. He ambulates with the use of a single point cane, is what I'll say in that situation. And then this next line over here, this line is only reserved for if, they've tried putting ice on it, they've tried massage, chiropractic treatment, physical therapy, and if any of those help, like how much did they help? A lot of patients will have tried physical therapy before coming to us. And so you can just say physical therapy has been tried with, if it's, I kind of just rotate through these words like temporary or minimal or partial, or just altogether just remove it if it did really help. And so I'm just going to say this provided him with temporary improvement. And then if the patient isn't taking any medications for it, usually it's like ibuprofen, Tylenol. Sometimes they won't mention it in the appointment, so it's important to look at the MA's intake because the MA does explicitly ask, what medications are you taking? I'll try to peek over at the face sheet to see if the MA wrote what meds they're taking, and usually it'll say like ibuprofen. And if they're taking it, they're usually taking it as needed. But if they're taking one every single day, then you could say daily. If they're taking it twice a day, you can say BID. And if they're taking it twice a day, you can say TID. If they're taking it only at night, you can say nightly. You just want to say the drug name and the frequency. And if it is mentioned, for example, if it's a prescribed drug that's mentioned, try to include the dosage if you know it. If you don't, that's fine. You can just leave it like this. But ibuprofen, for example, typical dosage is like 400 mg. Patients are in severe pain, they'll take more. And then same as before, because I already said improvement in the previous sentence, I usually use benefit for meds, but kind of the combinations that I rotate through are the qualifying word to show like how much it's better is like temporary, partial, or minimal. And then in terms of synonyms for like making it better, I just say improvement, benefit, or relief. So as you can see here, there's relief, improvement. So this is basically the entire HPI for new patients. It's pretty short, actually. Like, I know there's a lot of different stuff that I said that can be included, or a lot of different possibilities of stuff. In new patient appointments, it is a lot easier just because the patient is explicitly stating the stuff that will be filled directly into the template here. And so that's nice. And so I've kind of just gone over like what is relevant and what really does need to be included, like whether they're not able to sleep, like if they're using something to help them walk, or where the pain is located. And anything else that's notable at the end. If the patient doesn't speak English and they require a translator, you can say he is accompanied by someone who helps translate. If you know their relationship, you can list the relationship. If you know their name, you can list the name. If they had previous injections, you can add a sentence about the previous injections they've had. Or if they're going on a trip, that's important to know too, for scheduling purposes and also for knowing when to follow up. But in general, this is kind of what the most basic HPI looks like. And then that will cover or take up most of the appointments with most of the appointment time, especially with new patients, because mostly what they're just talking about is like how their symptoms are presenting. And so now we're going to move on to the rest of the note. Because this patient only has low back pain, that'll shape how we write the rest of it. So in the physical exam, Dr. Howe will ask them to stand up and kind of like bend backwards, or like bend to this, twist their shoulders, bend back to the side, or twist their shoulders the other way, bend back. And so what he's testing here is the extension and rotation maneuvers to end range of motion. And so if the patient does only have low back pain, regardless of what the patient says, at least for insurance purposes, we do write positive, just to prove that, to insurance that they are having pain with these movements, and it does confirm that they do have facet joint arthrosis, which is what patients with only low back pain usually have. And so if it's positive, you can say on the left or on the right, or on the left more so than right. Just because this patient is having pain across the low back, it's equal on both sides, we can just leave it as positive. And then we've already finished the x-ray read here. Typically, when we go into new patient appointments, they start talking kind of fast. And so once Dr. Howe is more just explaining about like how he's going to treat them, or like why he will, spoiler alert, need an MRI, this is usually when I start filling this part in. And then we can go to the assessment plan. And then this patient has lumbar axial pain. That is, what they have. They have pain across their low back. And if it's on one side, I'll just say left lumbar axial pain or right lumbar axial pain. But because it's on both sides, lumbar axial pain. And because it's only in their low back, and the issues likely facet joint arthrosis, I'm going to say that the lumbar axial pain is likely secondary to facet joint arthrosis. And so if there is a clear level that Dr. Howe is talking about or makes a guess, and he's saying it to the patient, what level it's at, then I will also say at, what level. But sometimes it's kind of easy to guess as well, because you can look at the x-ray read and see like, oh, well, they have severe loss of disc height at L4-5. They're probably having like a bulging disc that is making the facet joints work harder. And so I can kind of guess like, okay, well, it's probably at L4-5. And then also the degenerative disc disease is most severely at L, because it was the most severe there. If in the x-ray read it said something like, they have a slight anterior listhesis of L3-4. Then before the loss of disc height, I'll say anterolisthesis L3-4. And if that's the case, I will add another number at the end to mention that slight anterolisthesis. If they have anything like a chronic compression fracture or like a pars fracture, you want to make separate numbers for those as well. Pretty much anything that's worse than disc height, like if they have an interbody fusion, like anything that's worse than loss of disc height, you want to add as another number. So now that we finished the assessment part, we also want to start writing the plan. And so I'm going to say that the patient has an ongoing history of lumbar axial pain, because that's what they have. And then they've only had MRI images or X-ray images, so I'm going to leave it as X-ray images. And then I'm going to fill this out. He will be sent for further workup with an MRI of a lumbar spine. This sentence is required even if the patient hasn't done physical therapy, it's required for insurance. So we leave it in there when we're asking for MRIs or procedures. And so patients who have lumbar axial pain, and if they have facet joint pain, they will typically be prescribed Voltaire and gel. And so I'll just make a few, like go down a few lines and then click on the Voltaire and gel phrase. And then I can just cut and paste that into here. And then he will return for further treatment. So the reason this assessment plan has already been included with the template that we had just like input for lumbar knee patients is because all patients will need an MRI for us to see like the soft tissues and actually look at the nerves and look at the discs and see what's going on. And so if the patient doesn't already have MRI, like an MRI scan, they need to get one because that's how we can best determine how to treat them. And so if they're only coming in with an X-ray or they just got their X-ray done today, the next course of action would be to get an MRI. And so that's the pre-filled assessment and plan that we've included with our template. Basically, go get an MRI. So now we finished this chart note, and so I'm going to go back up and mark it as done, so Dr. Howe knows that it's done. And we filled out all the sections. I just double checked to make sure that we filled out the HPI, which we did. The physical exam is also done. This is done with the X-ray read that Dr. Howe gave, and this is also filled in, and everything's numbered correctly, and the first sentence reflects number 1 of the diagnosis, and all of the he's and she's, whatever, are replaced. All good, and then you can sign off. And that's how you do the chart note for a patient who's coming in for only low back pain and they're a new patient. This is kind of what it looks like. It doesn't deviate much from this, which is nice. And so, yeah, hopefully this helps. And hopefully you'll be able to do too.